Hello, you're watching Health Day Now. Today's episode will focus on patient care and protection, and what you should know before visiting a doctor or dentist. We'll speak with experts about how to protect yourself from medical gaslighting, explore the benefits of telemedicine, and investigate the risk of infections in dental water lines.
The average hospital bill for an older American with COVID-19 is nearly $22,000 according to a new study, and the financial burden is especially high among people of color. Researchers reviewed Medicare claims from 1.2 million men and women above the age of 64 who sought medical care for the virus from April through December 2020. Among these patients, 23% were hospitalized and just over 4% passed away. The researchers say while the cost for milder cases were relatively small, the average cost for a hospital stay was about $22,000. That jumped to nearly $50,000 if a patient needed a ventilator. The results also showed people of color had higher rates of hospitalization requiring ventilator support and death. The authors say these findings highlight the importance of identifying effective strategies to promote COVID-19 vaccination among non-white persons age 65 years or older to mitigate the increased disease and economic burden. The CDC is issuing a health advisory about bacteria in dental water lines after an outbreak of infections among children. While rare, the bacteria known as NTM has sickened dozens of pediatric dental patients since 2015. Some of them suffered permanent tooth loss, hearing loss, facial nerve palsy, and incision fibrosis, according to the CDC. NTM is found naturally in soil, dust, and water, but in some moist environments like dental water tubing, it can form a film that's hard to eliminate. To eliminate the risk of infection, the CDC recommends all dental water lines be treated regularly with disinfectants, and that offices routinely monitor water quality from their equipment.
Hello and welcome to Health Day Now. I'm Mabel Jong. It's confusing when your doctors, the people you've been conditioned to trust, doubt the painful symptoms you're describing. And then what's worse, when you start doubting them yourself. Welcome to medical gaslighting, an unfortunately common occurrence which leaves patients, especially women, feeling dismissed. If you have some form of chronic illness like endometriosis, which is both invisible and classed as a woman's disease, you may have experienced medical gaslighting in some form. I'm so fortunate to have two guests with me now to share their experiences and expertise. April Summerford is a podcast host and owner of Women's Health Leadership, a health and wellness coaching business based in California. And Dr. Christine Metz, researcher at the Feinstein Institutes at Northwell Health in New York. She also co-directs the ROSE study, which is seeking better treatment for endo patients. Welcome to you both.
Thank you.
Thank you for having us.
April, let's start with you. You first started experiencing chronic pain in your teens, crampy and extremely painful periods. What did it feel like working with doctors, trying to figure out what was going on?
Well, as you can imagine, when you're a teen, it's embarrassing, it's frustrating. It's really difficult to know what's going on. The history of pain in my family goes back so far that my mom didn't really bother to even say, like, let's go to the doctor, because she had never received help herself on her journey. So by the time I got to talk to my own doctor, which I remember being really excited to talk to a female OBGYN on purpose, I thought, okay, I'm going to go talk to a female doctor. She's going to listen to me. We'll have a conversation. And she had a pretty similar answer. She's like, well, you're a woman. And so that means, periods are painful. And so there's not a lot we can do. So I went to her for about 10 years, and it was a very long time before I ever got a diagnosis of endometriosis.
Wow. You were told that pain is normal for women, even by your doctor.
Yes.
Did that make you doubt what you were feeling? What other examples of gaslighting did you experience?
I don't know if at first it made me doubt what I was feeling. It was, when you go to an authority figure, like you were saying earlier, your doctor, right? Someone who's experienced, they have training, you're trusting them. and they tell you, well, this is going to be normal. You're like, okay, well, that's not helpful, but also, I know I'm still in a lot of pain. So I got to find something to help me with this. That was the first experience I had of medical gaslighting. The second time was actually after I had diagnosis, which I was very pleased to be diagnosed with endometriosis, because then at least I had a term for what I was dealing with and what I was experiencing. But the doctor that I had do the diagnosis did not treat the disease properly. He used cutlery and a burning iron. So he burned tissue further into my pelvis instead of removing those lesions. And so the second time was actually after that surgery. I told him, well, I actually feel worse. So it's great that you told me what I'm dealing with, but I don't feel any better. I feel worse. And he was like, well, here's some drugs and, you'll be on your way. I did the best I could, kind of a thing. And so he dismissed me as well, not telling me, that he hadn't gotten all the disease out and that there were other ways of managing the disease.
Yeah. I want to talk more about that second time. But first, Dr. Metz, lots of us Google symptoms all the time. Why is gaslighting still happening?
It's really a sad concept. I mean, clearly it's an emotional abusive strategy that patients begin to question their own symptoms and their own thoughts about how they're feeling and their own sanity. And gaslighting in women's health actually seems to be on the rise. This may be due in part to increased knowledge of the concept of gaslighting, but regardless, it is inappropriate. It is linked to poor patient outcomes, and it really has to be stopped.
Now, we keep talking about this happening to women. Why to women? And are we also seeing women of color specifically experiencing this? Lots of times women are diagnosed and treated differently by doctors than men, even though they might have the same health conditions. Why?
That's it. And it's true. There was a survey in 2019 that said that 17% of women felt that they were treated differently in healthcare because of their gender, compared to only 6% of men. And it does seem that gaslighting in the women's healthcare field seems to affect women more. I believe women of color are also experiencing serious consequences, but also other vulnerable groups. I think teens and preteens, as April said, and even those with disability, are just not taken seriously when they describe symptoms to a physician. And we just have to keep working to provide equitable care for everybody. Regardless of who you are, it shouldn't be the determinant of how you're treated. The treatment should be based on your symptoms and your medical workup.
April, we're talking about a medical workup that led to maybe perhaps the wrong path for you when you did get that diagnosis and then you got treatment. Tell me what happened at that point.
Yeah. So the first doctor I saw for a very long time eventually had a scan done. It's kind of amazing to me. It took that long for her to have me have an ultrasound scan, but we did an ultrasound. She thought she saw something abnormal on one of my ovaries. And then all of a sudden she was like, well, I didn't want to say this, but I think maybe you're struggling with endometriosis. And so she referred me to a local OBGYN who called himself a specialist, an endo specialist. However, he was using outdated treatment methods. So he did give me the surgery. It's a diagnostic laparoscopy. However, he used, like I said, inappropriate treatment methods for the disease. So as soon as I met with a true specialist, he was like looking at my pictures thinking, well, of course you're still in pain. You have all these lesions burned into your tissue. And he was kind of concerned about one of my fallopian tubes and said, well, we need to really make sure he didn't do damage.
And at that point, how many years had gone by?
Took me about 3 years from the first doctor. At least that was a little bit shorter. But the problem with this problem in general is that women are experiencing 10 years delay in diagnosis, then another 3 years delay of proper, treatment, plus another 5 years of something. It just ends up being this very long journey that doesn't need to be this long.
Is there a gender bias in research that may be at the root of all of this?
Absolutely. I do believe that there has been gender bias in research funding, and many female diseases, or those that affect women predominantly or more than men, appear to receive fewer federal research dollars when compared to conditions that affect primarily men. So, for example, endometriosis affects approximately 10% of females of reproductive age, and over the past 14 years received $176 million in research funding from the NIH. By contrast, hepatitis, which affects about 1% of the population in the US, but with more men affected, has actually received $4 billion from the NIH.
Wow.
Interestingly, the federal government, the NIH, has awarded 3 times more research dollars for a condition known as smallpox, which has been eradicated from this earth since 1980 in the past 14 years than endo. 3 times more funding.
Wow.
So I don't suggest we defund research on important diseases, but there is clearly a need to increase research dollars for women's health.
What is the advice you would give your younger self?
I wish that I could tell my younger self, like, you're going to have intuition about your body and where to go for help, and you should listen to it. You should not argue with yourself. You should just go do it, whatever that is, that intuition hit is. I'd also tell her that you know a heck of a lot more about your body than you think you do, or that anyone else tells you do. And you should tune into that and completely honestly trust yourself. And then I think the third thing would be, like, when you find someone like that who doesn't listen to you or isn't providing help, don't waste any time. Oh my gosh, if I could take back that first 10 years, I would.
Okay. Dr. Metz, what strategies should patients keep in mind when seeking help? Should the emotion be kept out of it when you're describing your symptoms?
So I kind of agree with what April said. I think women know a lot more about their bodies than they think they know. And I think the patients need to follow their symptoms and their instincts, and just clearly articulate what those are. Sometimes I recommend to patients to have things written down, what they want to cover with their physician. Because if it's written down, you have a little checklist and you can go through it. Because if you experience being dismissed, you don't become emotional about it and shut down, but rather continue on your list. And if healthcare providers don't listen to you, as April felt, and I hear this repeatedly, and your response to concerns aren't what you're expecting, it's time to find another one. And just like April said, I think women need to follow their instincts. Even if someone has told you this is the best doctor in this area, if you don't feel you're getting the treatment you deserve or feel you need based on your symptoms, you have to move on. And severe period pain is not normal.
Mm-hmm. All right. April Summerford, thank you so much. April Summerford, podcast host and owner of Women's Health Leadership. And also our thanks to Dr. Christine Metz, researcher at the Feinstein Institutes of Northwell Health. Thank you to you both.
Thank you.
Thank you.
And I'm Mabel Zhang. You've been watching Health Day Now.
Minority women are experiencing significant delays in getting life-saving breast biopsies, a new study finds. The study included more than 45,000 women whose screening mammogram showed a tissue abnormality that required a biopsy to determine whether it was cancerous. Researchers looked at the number of patients who received biopsies within 30, 60, and 90 days. At all 3 points, Asian, Black, and Hispanic women faced a much larger risk of not undergoing a biopsy compared to white women. At the 90-day mark, Black women had a 28% higher risk of no biopsy, Asian women had a 21% higher risk, and Hispanic women had a 12% higher risk. The lead author says even after adjusting for multiple factors thought to contribute to delayed diagnosis, we still see persistent disparities among minority women, particularly Black women. The findings did, however, show that differences at screening facilities impacted biopsy timing. The authors say interventions are needed to reduce systemic racism and healthcare system barriers to timely diagnosis after abnormal mammography results. More dentists say patients are coming to their appointments high on marijuana or another drug. The American Dental Association warns being high can limit treatment and impact the effectiveness of anesthesia. The ADA surveyed more than 550 dentists earlier this year, and 52% reported patients arriving high, often causing a delay in care. Marijuana can lead to increased anxiety, paranoia, and hyperactivity, which could make the visit more stressful, according to a spokesperson from the ADA. She warns pot can increase your heart rate and cause respiratory side effects, making the use of local anesthetics riskier. The ADA also polled about 1,000 consumers, and 40% reported using marijuana. Regular use of the drug has been linked to an increase in cavities, and some studies have shown smoking it may up the risk of oral diseases, including mouth cancer. The ADA advises patients to refrain from using marijuana before dental visits. Are video visits with your doctor as reliable as in-person visits? A new study finds they're highly accurate for many health concerns. The study included nearly 2,400 patients who underwent a video consultation followed by an in-person visit for the same medical problem within 90 days. Researchers say the provisional diagnosis made via telemedicine matched the diagnosis made at the in-person visit 87% of the time. The authors say these findings suggest that video telemedicine visits to home may be good adjuncts to in-person care, but they also point out the diagnostic agreement was lower in primary care than in medical specialties such as oncology and psychiatry. They say the timing between home and in-person visits may need to be shortened for new primary care patients, as well as those with suspected diseases that require biopsies and other testing to confirm.
Thanks for watching Health Day Now.